Have you ever been told by a doctor that you have IBS or Irritable Bowel Syndrome and then just felt completely dismissed? Like you were essentially rushed out the door with nothing but a recommendation for fiber, an anti-diarrheal, or maybe even an antidepressant? Well, if so, you're not alone. IBS affects 11% of the global population, and as an integrative medicine doctor, I hear from patients every day struggling with IBS symptoms because they've never gotten real help. Well, today, I'm hoping to change that. Whether you have abdominal pain, bloating, constipation, diarrhea, I'm hoping to explain what is actually the root cause of those symptoms and how to treat it. But first, we need to talk about what a diagnosis of IBS really means. So the first thing to understand about IBS is that it's not a clear-cut disease that has a specific lab marker or a specific known cause. It's just a syndrome, meaning it's a constellation of symptoms, bloating, constipation, diarrhea, etc., that have no clear identifiable cause. This is different than something called IBD, or inflammatory bowel disease, which has very clear-cut colonoscopy findings, biopsy findings, and even blood markers. IBS, on the other hand, has no test. It has no lab markers, no colonoscopy findings. It's just a syndrome. And importantly then, it's a diagnosis of exclusion. And a diagnosis of exclusion essentially means that if you have a certain set of symptoms and then the doctor excludes all other potential causes of those symptoms, then we don't know what it is and we just label IBS. So let's break it down a little bit further. To get an IBS diagnosis, you first need to have a certain set of symptoms. Again, it's that syndrome. The set of symptoms is defined by the Rome 4 criteria, which is 1, you have to have recurrent abdominal pain at least 1 time per week for 3 months. And then you need 2 of the following: pain associated with bowel movements, a change in how many bowel movements you're having per day, or a change in your stool consistency. If you meet this symptom criteria, and your doctor rules out other severe causes, and they might have to do testing for this if you have red flag symptoms. If they rule all these out and you have these symptoms, then you're lumped into an IBS diagnosis. More specifically, you're categorized into IBS-D, or IBS diarrhea predominant, IBS-C, or IBS constipation predominant, or 3, IBS-M, or mixed constipation and diarrhea. However, this is where the problem lies, because then everybody that's lumped into this IBS category gets the same generic advice: fiber, antidiarrheal, antidepressant, and then you feel dismissed because you're not getting real help tailored to your specific situation. Because here's the thing, doctors are excluding severe causes. They're excluding IBD, they're excluding cancer if they feel like they need to look into that, and maybe they're excluding celiac disease, but they're not excluding all root causes of your gut symptoms. And instead, you're just getting IBS diagnosis. So today, I want to clear this up. I'm going to talk about these 7 top root causes for IBS type symptoms. And we're also going to use patient cases to see if you can draw any parallels with your own symptoms and see how you can treat it at home by yourself. So the first root cause to talk about was seen in a 25-year-old female that came into my clinic who was having bloating almost exactly 30 minutes after every time she ate. She also had occasional acid reflux symptoms and heartburn. She noted that all of these symptoms were worse when she was stressed or when she had protein-heavy meals. And her bowel movements were mostly normal, but she had occasional constipation and diarrhea. She had already been diagnosed with IBS from another provider because she had a colonoscopy and an endoscopy that were all normal. So she came to me looking for some actual treatment of her symptoms. So the first thing that I did in this case was tested her stool with a comprehensive stool analysis. I always use GI effects from Genova. I have no affiliation with Genova or this test. I just think it's really helpful in my clinical practice. And for these cases, I think it's really going to be helpful to explain the root causes that are going on. You definitely don't need to do this test to treat your symptoms, although it can be helpful, but you can just go based on the symptoms that we're kind of describing with each patient case and treat that way. But in this case, after we ran the GI effects test, the main finding was a low products of protein breakdown. And this signaled the first root cause of IBS symptoms, which is low stomach acid or hypochlorhydria. And essentially how this happens then is stomach acid is super important for breaking down proteins. So if you have low stomach acid, you're going to have less products of protein breakdown. And that's how it can be signaled on the GI effects test. And then it also leads to symptoms because if you're not breaking down your food well in the stomach, it's not going to be digested, and it's going to sit in the stomach longer, which is going to cause you to feel bloated, especially right after you eat, because the stomach is the first place that food is going to go. So if you're having bloating immediately after meals, this is one you should consider. And it also can cause acid reflux, because again, if food is just sitting in that stomach undigested, it's going to have more of a tendency to go the wrong direction. This is why taking PPIs, or acid reducers, is not always helpful in all cases of heartburn, because sometimes heartburn and acid reflux are actually due to low stomach acid because you're not breaking it down and, again, going the wrong direction. So how do we fix this? Well, the first thing that we do is add in some stomach acid. Pretty simple. And the stomach acid you can generally find in supplements is called betaine HCl. Generally, what I recommend is you take one capsule, which is generally about 500 milligrams, with every meal. You then work your way up, adding one capsule with each meal until you feel some burning sensation, and then you back off, and this can be your dose. Or you can just go until you don't feel symptoms any longer. I generally wouldn't go higher than 5 capsules, or about 2,500 milligrams of betaine and HCl. At that point, you probably need to be looking for a different root cause, but something to try. However, I would not try this if you have a history of ulcers, as that could 100% exacerbate that. And for brands, I really like Pure Encapsulation's betaine and HCl with pepsin here. It's a really great third-party tested, pure quality product with no contaminants, and it's really safe for those sensitive stomachs. And again, I have no affiliations with any brands or any products mentioned in this video. Outside of just giving back stomach acid, you can also promote more stomach acid naturally. One way to do that is by chewing your food. When you are chewing your food, you're giving stimuli to your stomach to produce more acid because it knows that food is coming. Ideally, I would chew your food 20 times if you're trying to focus on this. The second thing to do would be to limit water intake with meals. If you're taking in a bunch of water while you're eating, you're essentially diluting your stomach acid, which is going to create more difficulties breaking food down. Also, eating in a non-stress state and just working on chronic stress levels can really improve stomach acid production. Reason being is if you're in a sympathetic state or a fight or flight state, you're going to produce much less stomach acid than if you're in a parasympathetic state or a rest and digest state. So with all of this advice, plus starting to take stomach acid with meals, our patient in this case improved very rapidly and no longer had IBS symptoms. The next root cause was seen with a 45-year-old female that came in with a very different IBS picture. This time it was chronic diarrhea 7 to 8 times per day. She also noted that her stools were more oily, floated to the top of the toilet, and occasionally even had undigested food particles in them. She also noted some brain fog and fatigue, and also bloating, but this time 1 to 2 hours after meals normally. Again, she had been diagnosed with IBS already, but was just not getting any help. So we ran the GI effects test, and this time found the second root cause of IBS symptoms, and that is low digestive enzymes. And on the GI effects test, this is seen with a low pancreatic elastase. Now, digestive enzymes come from all throughout the GI tract, but most predominantly from the pancreas. And they really help break down all types of food once it gets to the small intestine. So the symptoms from low digestive enzymes then essentially are having fatty stools because you're not able to break down the fat, so then it comes out in the stools because you aren't then absorbing it. 2, you would have undigested food particles because you're not able to break down protein or carbs either. And 3, you'd have bloating 1 to 2 hours after meals this time, because that's how long it generally takes to get to the small intestine where those digestive enzymes would work. And now we're not breaking down food there as we should, so the bloating occurs. And finally, because you're not able to break down food correctly, you're also not able to absorb it correctly, which generally means you're getting less nutrients, meaning more fatigue, and you're having brain fog because of inflammation in your gut from all this unabsorbed food, and because you're just, again, not getting enough broken down nutrients from food. So how do we fix this? Well, pretty simple. Similarly to the stomach acid, we give back the ingredient that's needed, which is digestive enzymes. Now, when you're selecting a digestive enzyme product, first, it's important to see how low were your levels. If your levels were extremely low on a test such as that, then you're probably going to need an actual prescription. However, if you're just mildly low or you're trying to treat this yourself, you should try a broad spectrum supplement, meaning that there's a lot of different enzymes included to help break down all types of food. My go-to here is again from Pure Encapsulations. Their Digestive Enzymes Ultra is again a very broad spectrum digestive enzyme that again is a very high quality product that really works for patients, I find. Essentially, just like the stomach acid, you take these with meals. However, I wouldn't work your way up as you do with the stomach acid. I would just basically take what is recommended on the bottle. And same lifestyle advice still goes here. lower the chronic stress, eat when you're relaxed, and chew your food 20 times. All of that, just like it stimulates stomach acid production, will also stimulate digestive enzyme production and will help you digest your food better. And this patient, again, after taking all that advice, using the digestive enzymes, really very quickly noticed a resolution of her symptoms. The next root cause of IBS symptoms was seen in this 20-year-old female who had constipation. She noted that she only had a bowel movement 2 to 3 times per week, and noted that her bowel movements were much smaller than they used to be. She also noted that she would get full very quickly when eating. And then, of course, she was diagnosed with IBS from her original doctor. She then was also, of course, told to take more fiber, but she told me that when she took fiber, it actually made things worse. She would get more constipated and also feel even more bloated. So again, here we ran the GI effects test, and this time it demonstrated something in the microbiome section, or essentially the section that looks at the good and bad bacteria that live in your gut. For her, it noted that she had the third root cause of IBS symptoms, which is a low microbial diversity, essentially not having enough good bacteria living in your gut. This was seen on the test because it directly looks at the microbiome, and it also looks at short-chain fatty acids, which in her case were low. Short-chain fatty acids, such as butyrate, are created by the good bacteria in your gut, and they're super important for gut health, metabolism, the gut-brain axis, etc. So if you have low short-chain fatty acids, it's likely that you have less good bacteria living in your gut. And because you have less good bacteria and less short-chain fatty acids, your gut motility slows down, which will cause constipation. You also have less bulk in your stool because the good bacteria eventually die off and do create some bulk in that stool. So you have less bulk, your gut is moving slower, all that's causing constipation. And when you try to take fiber, it doesn't get broken down by the good bacteria like it should. So it sits there unbroken down, undigested, and that causes more bloating. And now it blocks up your stool and causes more constipation. So how do we fix this low microbial diversity? Well, the first step is with diet. You have to be eating a wide array of plants, vegetables, fruits that all have different prebiotics, or the thing that feed the bacteria in your gut. They have different fibers, different polyphenols that will essentially grow different types of bacteria in your gut and allow them to flourish, and then essentially you'll improve the diversity of your microbiome. The second thing to do here is to slowly introduce fermented foods. Truly fermented foods that are unpasteurized have a ton of live microorganisms in them that will contribute to microbial diversity. Slowly introduce them because it can create some symptoms if you ramp up too fast. But the things to maybe include would be kefir, kimchi, kombucha, or even sauerkraut. Then after adding in some fermented foods, you can also start to add in more and more fiber to start feeding all these live organisms that you're giving your gut and to flourish that diverse microbiome. And supplement-wise, the two that I always recommend in this case are a high-quality probiotic and a high-quality prebiotic, or a high-quality fiber, or a soluble fiber to be exact. And if you want to learn about which probiotic and which fiber to do, check out my top 5 supplement series where I go into this in depth. But for this patient, we gave her a good probiotic, we gave her a good fiber, we worked on her diet, and with all that, in a few months, she built up that microbiome diversity and was feeling a ton better. The next root cause was demonstrated by a 57-year-old male who came in at the urging of his wife due to significant diarrhea, up to 8 times per day. He also noted some occasional bloating, but was unclear on when it occurred in relation to the time that he ate. And he also noted significant fatigue and brain fog. So again, we did the GI effects test, and again, it had something to do with his microbiome. And this time, for that fourth root cause of IBS symptoms, it was due to a microbial overgrowth, a different type of dysbiosis. So how did we see this on the test? Well, multiple markers. One was an overgrowth of commensal bacteria, and these are essentially bacteria that are normally not too bad unless they're overgrown. It also showed an overgrowth of opportunistic bacteria, essentially bacteria that can overgrow when your gut microbiome is misaligned. It also demonstrated a high beta-glucuronidase. This is an enzyme that's created by bacteria in your gut, but if it's way too high, it can disrupt the detoxification process, and it also, again, signals that there's too much bacteria in your gut. And finally, his test also demonstrated a high fecal secretory IgA. Essentially, this is an immune marker that demonstrates that his gut is trying to fight something off, or essentially in this case, it's trying to fight off that overgrowth of bacteria. So what is happening here to cause the symptoms? Well, All of these overgrown bacteria, when they eat the food that you take in, they produce a lot of gas. And these bacteria are overgrown, in this case, in the colon. And it can take 4 to 6 hours after you eat for food to get to the colon for it to then be eaten by the bacteria and cause all this gas, which will then create the bloating. But the time frame is often unclear for patients because it takes so long after eating. And then all of this gas will then create inflammation in your gut, which will lead to the significant diarrhea that this patient was having. However, depending on the bacteria that are overgrown, it can also cause constipation. And regardless of the bacteria that are overgrown, again, that inflammation will cause fatigue and brain fog due to the gut-brain axis and how intricately linked the brain and the gut are. So how do we treat this root cause of IBS? Well, it's a 3-step process. The first is to kill off all these bad overgrown bacteria. There are multiple ways you can do this, but my go-to is 3 herbals. 1, berberine at 500 milligrams twice a day. I like integrative therapeutics here. 2, cat's claw at 450 milligrams twice a day. I like pure encapsulations here. And 3, grapefruit seed extract at 250 milligrams twice a day. And again, I use pure encapsulations here. These have very strong antimicrobial properties to kill off these bad bacteria. However, when we are killing them off, you can have something known as a die-off reaction. Essentially, all of these dead bacteria particles can be inflammatory and cause worsening symptoms in the short term. So to avoid this, I generally like to ramp up to the main dose I just told you. So start for the first 5 days, only taking 1 time per day of those herbs. And the second thing you can do is if you do have worsening symptoms while treating this, you can use activated charcoal, I like the one from Integrative Therapeutics, to essentially wrap up the inflammatory particles and inhibit some of that die-off symptoms. And this phase of killing off these bad bacteria generally lasts about 30 days. To also support the gut during this time, I generally do some anti-inflammatories like an omega-3 and some other nutrients to help repair the gut lining, such as glutamine or zinc carnosine. Outside of supplements during this phase, diet is also important. You should probably use a low FODMAP diet during this stage. FODMAP essentially stands for fermented oligosaccharides, disaccharides, monosaccharides, and polyols. Essentially, the fermented carbs that will eat and then cause the bacteria to keep growing. So by eliminating these foods, eliminating the FODMAPs, we can essentially help starve off the bacteria while we're also killing them with the herbs. So that is stage 1, the killing off the bad bacteria phase, generally about 30 days. The second phase is the rebuild phase. Essentially, now that we've killed off the bad bacteria that are overgrown, we start to rebuild the microbiome with some good bacteria. I really like using a spore-based probiotic here. They're really good at surviving the harsh environment of an inflamed gut that just had all these bacteria killed off. I really like the ProbioSpore by Designs for Health, and I generally recommend taking it for 3 months when starting this rebuild phase. I also like to slowly add back in some good prebiotic fiber to help grow that spore probiotic and slowly wean off the FODMAP diet onto a diet that includes more fiber, more polyphenols to start, again, rebuilding that microbiome now. And then stage 3 is essentially your maintenance phase. We want to then switch to another good high quality probiotic, again, a good prebiotic, and then also add more diverse foods in, have a complete diet, and really flourish a great microbiome for the long term. For this patient, after really a couple months, his symptoms were much improved after we'd killed off those bad bacteria and started to seed his gut with good ones. Then he was able to transition to that maintenance phase and maintain good gut health. Our next root cause was seen with a 34-year-old female who came in for bloating. It was always 1 to 1.5 hours after eating, and she also noted some gas and belching a lot, and she noted some occasional diarrhea and constipation. For this one, I was very confident in what it was off the bat, so I added in another test along GI effects, and that is the SIBO breath test, or the small intestinal bacterial overgrowth test. And sure enough, that ended up being the root cause of her IBS, the 5th root cause, which is SIBO. So a quick breakdown on small intestinal bacterial overgrowth. Essentially, it's very similar to the microbial overgrowth that we just talked about. However, the location of where those microbes are overgrown makes all the difference. Previously, we were talking about a microbial overgrowth in the colon or the large intestine. Now we're talking about it in the small intestine, hence SIBO. And this will create bloating that is very consistent about 1.5 hours after eating because, again, that's how long it takes for the food to get to the small intestine, where then those overgrown bacteria eat it, create the gas, which creates the bloating and the inflammation, which can lead to diarrhea or constipation, etc. The SIBO breath test essentially is you take in some lactulose, which the bacteria will then ferment and produce gas. Then you breathe out and collect the gas that is produced, and the gases that are tested for generally are hydrogen, methane, and hydrogen sulfide. The two most important of which being hydrogen and methane. Because if you have high hydrogen gas, that generally relates to a diarrhea predominant SIBO, and if you have methane predominant gas, that generally relates to a constipation predominant SIBO. And SIBO is a huge one. Studies have shown that 40% of IBS cases are actually due to SIBO. So what do we do about it? Well, conventional treatment is with antibiotics, and it depends if it's hydrogen or methane predominant. For hydrogen predominant, you use rifaximin, and for methane predominant, you use rifaximin plus metronidazole or neomycin. However, here's the kicker. These antibiotics are super expensive. Rifaximin is almost $3,000 for the course that you need to treat it, which is just unattainable for many people. So, fortunately for us, we have some pretty good studies that demonstrate that much cheaper herbs outperform even these antibiotics. And the herbs that are used in the studies are Candibactin AR and Candibactin BR from Metagenics. Again, no affiliation here, but I use them very commonly to treat SIBO and have pretty good success rates. And to treat them, it's 2 capsules of each 2 times per day. In the studies, they only did it for about 30 days. I generally find a little bit more success with 45 days of this treatment. And then if you're more constipation predominant with the 1.5 hour bloating, then I also will add in some super garlic from Metagenics because that will help treat that methane producing bacteria. And then after this, it's basically just like the microbial overgrowth root cause. We have to follow that 3-step plan. Step 1 is we kill those bacteria with the Candibactin AR and BR and garlic. 2, we rebuild with a spore probiotic and slowly reintroduce good, diverse foods. And 3 is the maintenance phase. We switch to another high quality probiotic, we give some prebiotics, and we eat even a more diverse food profile. And again, this patient did really well after those 45 days of the initial treatment. However, it is worth noting here that SIBO is notoriously difficult to treat and it has a high recurrence rate. And this also goes for the microbial overgrowth root cause. It's very important to look at other additional root causes that might have initiated SIBO. For instance, you might have SIBO, but you might have also low stomach acid or low digestive enzymes causing that SIBO. So it's important to think back on your symptoms and see if you also need stomach acid or digestive enzymes, or maybe just get that GI effects test to see if there's other things that you need to do to make sure that the SIBO does not come back. Our next root cause was seen by a 42-year-old man who was an avid hiker, and he also frequently traveled overseas. He came in complaining of months and months of severe diarrhea. He noted that it was also very greasy occasionally and would also float to the top of the toilet. He also noted occasional abdominal cramping as well. So again, we ran the GI effects test, and this time it pointed to a very clear culprit, and that was a parasite, and specifically a protozoa known as Giardia lamblia. And this case highlights the 6th root cause of IBS symptoms, and that is chronic infections. And these infections can come from a variety of bugs. Parasites, such as Giardia, can also come from bacteria, such as E. coli, and can also even come from fungi, such as Candida. These infections often show up after international travel, hiking, and taking in poor water sources, also after antibiotic use, or even after a viral illness. And this process can be very inflammatory, so inflammatory that it can sometimes even cause blood in the stool. But most commonly, it's causing that chronic diarrhea, if it is a chronic infection, and it's causing cramping with bowel movements as well. Occasionally, it can cause constipation, but diarrhea is much more common for these chronic infections. In this case, Giardia is pretty classic, where it causes that greasy, fatty type stools. And that is one of the only infections that does that. So to treat this, it's pretty straightforward, but you really have to know exactly the bug that you're trying to treat. It's straightforward because if you look at a GI effects test, it'll even tell you essentially what herbs or what antibiotics will treat it. So for this case, Giardia is treated by metronidazole or an antibiotic, but it really just does depend on what bug you're treating. So this is where the test can be super helpful to know exactly how you need to treat it. But once you find out which herb or which antibiotic can be used to kill that bug, again, it's the 3-step process. It's killing with antibiotic or herb. It's then rebuilding with a spore probiotic, and then gradually introducing in a healthy diet. And 3, it's maintaining good probiotic, good prebiotic, great diverse diet. In this case, the man's symptoms improved only in 10 days with antibiotic treatment, and it's a super satisfying one to treat. And finally, for our last root cause, it was seen by a 25-year-old male who came in for on and off bloating and on and off constipation or diarrhea, none of which are associated with the timing of which he ate. And he also had a chronic rash as well on both of his arms. After some further digging, he did note that he seemed like all of his symptoms, including the rash, got worse when he ate dairy. However, he couldn't really determine any other foods that worsened his symptoms. So in this case, again, we ran that GI effects test, and it didn't show one culprit very easily, but it showed signs to that seventh and final root cause of your IBS symptoms, which is food sensitivities and allergies. On a GI effects test, this shows up as a couple things. One, a high fecal secretory IgA, essentially, again, that immune system ramping up without evidence of a dysbiosis. It also demonstrates a high eosinophilic protein X, or EPX. It's an allergic reaction marker, could also be high with parasites though, but again, no parasites in this instance. So if I ever see a high IgA and a high EPX in the stool without a dysbiosis or a parasite, I'm thinking food sensitivities and allergies as the cause of IBS symptoms. But you might be wondering, wouldn't I know if a certain food was causing all my symptoms? Well, yes and no. If you're having a true food allergy, you might know, because true food allergies are known as IgE mediated. This type of immune response to a food happens pretty suddenly, most times within an hour or at least within 2 hours after eating the food, and you might notice increased symptoms then. However, food sensitivities occur through an immune process known as IgG mediated or complement mediated. These immune responses can happen 4 to 72 hours after you eat. So there's really no way you could know if you're having a sensitivity to certain foods without testing for it. So it's really very difficult to know if you have sensitivities to foods because you might eat a food on Monday and not have symptoms until Wednesday. And these symptoms include constipation, diarrhea, bloating, like the patient here, and that chronic immune response and that chronic inflammation also leads to rashes like this patient had. So if you suspect this is happening to you, how do we treat it? Well, there's two options. One is we can do a comprehensive food allergy and food sensitivity test. These will tell us all the IgE mediated responses you're having, those immediate responses, and the sensitivities, all the IgG and the complement reactions that you're having. That could occur 4 to 72 hours after you eat. Then we know exactly which foods that we need to eliminate, and we eliminate those foods for 2 to 3 months. And then after that time period, once you've given your immune system time to calm down, you can start to slowly, one by one, reintroduce the foods that you eliminated. Most times, after you've eliminated the foods you're sensitive to for a while, those ones that you have IgG and complement reactions to, you can actually reintroduce them successfully because your immune system has now calmed down and is no longer trying to fight off these foods. However, sometimes you do need to eliminate the foods more longer term when you reintroduce them and you notice new symptoms. So that's one method, is doing the test. However, the test is often pretty expensive. It can be up to $400 and insurance probably is not going to cover it. So the second option is a more budget option, and what you do here is a 6-food elimination diet. Essentially, there are 6 foods that are most common to be sensitive to. Those are gluten, dairy, eggs, shellfish, soy, and nuts. If you eliminate all of those for 2 to 3 months, you're likely going to be feeling a lot better if food sensitivities are your problem. And from there, it's the same thing as if you tested. You then slowly, one by one, add back in these foods after the 2 to 3 month period. This obviously a very budget option, and it can be very, very effective. However, regardless of which option you're choosing, I would highly recommend you get your doctor to test for celiac disease. Celiac disease is much more common than what you'd think, and a simple blood test can be 80 to 100% sensitive for celiac disease, so it's a very useful thing to screen for if you think foods, and specifically gluten, might be causing your issues. For this patient, he used that 6-food elimination diet, and after the 2 to 3 month elimination phase, his rash had disappeared and he was feeling much improved. So those are the top 7 underlying causes of gut symptoms for people who are diagnosed with IBS. Take a moment, go back through all of them in your mind, and see if you feel like you need to get tested for them, or if you can just judge it based on symptoms and start treating those symptoms proactively and actually getting at the root cause that we talked about. However, we should note this is not an exhaustive list. There are a lot of other potential root causes of IBS symptoms. These are just the top 7 that I see in my practice. What even complicates the picture further is, like we mentioned, a lot of these root causes go together. So a low stomach acid can lead to a dysbiosis, and you have to give stomach acid back and also treat that microbial overgrowth. Or food sensitivities could be caused by a poor microbiome. So you need to restore microbiome diversity while also treating those food sensitivities. A lot of times the symptoms can overlap. If your symptoms overlap and it's not a real clear picture and you don't know which direction to start with, then drop a comment with your situation below and I'll try to help out the best I can. And in the meantime, watch this video on urine pH to figure out one simple test you can use at home to prolong your life and optimize your performance.